So President Trump, in a wide-ranging interview with Bill O'Reilly before the Super Bowl, saying that repealing and replacing Obamacare might not happen until next year.
Obamacare doesn't work. So we are putting in a wonderful plan. It's statutorily takes a while to get. We're going to be putting it in fairly soon. I think that, yes, I would like to say by the end of the year, at least the rudiments, but we should have something within the year and the following year.
Dr. Mark Siegel is a member of our Fox News Medical A team and a professor of medicine at NYU Langone Medical Center. Doctor, thanks for joining us.
Hi, Melissa.
That got a lot of attention yesterday because obviously, you know, he had said coming in he was going to do it right away. Now he's saying that that may be a little bit more difficult. What did you think about that timeline he laid out there?
No, I think there's a lot of honesty to that. You know, some of the pieces of Obamacare that are going to be repealed can be done right away, should be done right away. For example, the individual mandate is almost unenforceable. You know why? Only 30% of the people signing up for Obamacare are young. And you know why? Because they don't want to pay high premiums for something that can't happen to them. So don't enforce the individual mandate. That he could do right away, especially if we know that eventually we're going to repeal Obamacare. Second, the essential benefits package, where the whole policy is front-loaded, which, Melissa, leads to high premiums. You know, right. No copays, no deductibles for colonoscopies, mammograms. Sounds great, very, very expensive. You don't have to enforce that. The third thing that I might want to see right away is a catastrophic option, right, where young people could say, hey, if I go to the emergency room, if I need a hospitalization, some low-cost, low-premium insurance could be introduced right away to protect the public from somebody getting suddenly
But you know
ill.
what's missing in all that you're saying, though, is how do you pay for the really sick people? I mean, because everything you're talking about is more cost-effective and makes a lot of logical sense. But the reason we had all those other things in place is because we're trying to pay for the people who have pre-existing conditions and use a lot of health care. How do you pay for that?
Well, that's why I think President Trump is saying it's going to take a while, a year or two, for this whole thing to be fixed, because the ultimate goal is probably to create high-risk pools where those with pre-existing conditions can be subsidized by the government. Right now, almost everybody's subsidized by the government. If you go to the state exchange, you pay $350 for a premium on average. $250 of that comes out of the taxpayer pocket. That's what's got to change. The state exchanges aren't working, but critics are saying, wait a minute, we don't want 30 million to lose their insurance right away.
Right.
So let's honor the state exchanges as we try to reform Medicaid, to get malpractice reform, to get a cheaper option, and to create high-risk pools.
Let me drill down on that point a little bit, because that's a solution that I haven't heard from a lot of people that makes sense, because this is where it's tricky. So you're saying put people into high-risk pools that go over different state lines. This is something Rand Paul had talked about as well. That's still, in my mind, of getting all these people together doesn't solve the problem of how you pay for it. That's just a bigger group. You're saying of those pools, that's where the government's money that's already being spent, frankly, should be directed.
Absolutely. Because I agree, and many other critics of Obamacare agree, that pre-existing conditions have to be covered. That's in the best interest of the government. It's in the best interest of the patient. It's the best interest of the doctor. I want to know that my diabetics, that those with heart disease, that those with emphysema are going to be covered. That's where government subsidy should go. Why should somebody else get a government subsidy who's completely well? Why should the worried well get paid for by the government? That's socialized medicine. So move more. Oh, and I also should mention that President Trump and Congress wants to move more in the direction of choice. Health savings accounts. That's going to take a while to get health savings accounts expanded. And insurance across state lines, Melissa, there's a law on the books since 1945 that you can't do that. So they're going to have to change that. They're going to have to take that
away. Right. Yeah, absolutely. Forgive me when I say the government's money, that's your money out there, the taxpayer. That's who it really is. The government doesn't have its own money. It's taken it out of our pocket.
Great point.
Another point that you make is about price transparency, this idea that people have to know, as opposed to you have no idea what the bill was when you leave the hospital. Insurance paid for it. You get your deductible, whatever your portion is, you pay that. This led to a lot of different problems, because when people's deductibles went up, all of a sudden, you were actually paying the price that the insurance company had negotiated with the provider. So you're like, wait a second, I didn't agree to pay $1,000 for this visit to the doctor. You say that we need to get both drug companies and doctors together with patients, more transparency, see what those prices are, and negotiate on that level? How do you do that?
As a great business anchor, you understand this point, that I did some research and found out an echocardiogram costs $1,000 uptown, but $600 downtown, and nobody even knows about that. It's one thing for chemotherapy right out of the chute, immunotherapy, to cost $100,000 a year. Yeah. It's something else for treatments that have been around for a while to maintain their high prices because nobody knows about it. So the idea that President Trump wants Medicare to negotiate prices, that's a huge block. That's going to bring down prescription drug prices. More negotiation, more knowing what you pay for, more health savings accounts to pay for things. You know, you're going to go out there to the marketplace and say, hey, wait a minute, I'm going to the guy who charges me less for a chest x-ray, right? Right,
yeah, or it's up to you to decide if you want to pay more, but that's your decision.
If there's a better provider, you pay more.
Yeah.
If you know someone that's the best, they charge the highest.
There you go. Thank you so much, Dr. Siegel. Great stuff.
Great to see you.
Eric.